Hi, my name is Shinko. Welcome to my channel, my life of stuff. um, so anyone who follows any of my platforms, any of my social media, knows that I am a chronic pain patient. I do take some medications. I have health issues, cyclic vomiting syndrome. I have back issues, degenerative disc disease. I have seizures. A bit of stuff here or there. I've died before, just small things. Anyway, so I have just moved from Tucson, southern Arizona, to Northern California. We were told over and over that my fiance could add me to his plan as a domestic partner. They knew we were getting married, but we're not married yet. We told them multiple times, I am a woman, he is a man. Are you sure I could be added on as a domestic partner? And for anyone who knows the meaning of domestic partner, it's essentially a gay couple, all right? It's a same-sex couple. But this is not me hating at all. They just told us that's what we could do, so we're like, okay, all right, we'll do that. I get out here, and then it turns out, oh, no, you can't do that. You're not a gay couple. Okay, whatever. So we figured that out. We got me emergency insurance for now until we get married. I got to see the doctor. Now see, it's kind of complicated. I take pain medicine, I take anti-seizure medication, and I have nausea meds. With that pain medicine, I go into withdrawal. Withdrawal for me, my stomach overreacts. Stupidly. Just like it overreacts to everything, my stomach overreacts without pain medicine. I get incredibly sick. I throw up a lot. Over a year ago, it would have just been an issue of keeping fluids down, and I'll go in every few days to the ER if I have to, but only when it's a must. But now that I'm on anti-seizure medication, that's a different story. It kind of goes hand in hand. You see, if I don't have the pain medicine and I'm throwing up, I can't take my anti-seizure medication. It doesn't stay down. So then I become a huge risk for seizures. Anti-seizure medication isn't like alcohol or pain medicine where if you stop, you get into withdrawal and it's uncomfortable, whatever. Without anti-seizure medications, you will have seizures. So that's a fun fact. Okay, so go to the doctor, explain my medical history, explain what's going on. I had a checkup. So, then I had to make a choice. And it's a really, really hard choice that, a lot of chronic pain people have had to make. The common choice is the choice between pain medicine and medications like psych medications. Anti-anxiety, for example, or some antidepressants you can't have if you're on pain management. So some people are forced to choose mental health or physical health. I had a similar choice today. It wasn't for mental health, no. But I got told I can't have my medical marijuana. Knowing my history, knowing everything I've gone through, that's essentially telling me to make a choice between treating my nausea, treating me being able to eat and drink, or my pain. But see, if we just treat my eating and drinking and if we treat only just the nausea, the pain will make me throw up. Treating just the pain, the nausea can cause pain. They completely play on each other. And it's a lose-lose situation for me. It's win-lose. I could get into a rant about, patients shouldn't be forced to make decisions like this. We shouldn't have to make the hard choices of Okay, what part of my body do I have to sacrifice to help this other part? But I'm just tired. I'm just tired ultimately. So I have made the choice that I will go off the marijuana. Because I already know for sure without the pain medicine right now anyway. Without being weaned, reduced, or under supervision or given help, without the pain medicine, I'm at risk. But if I have pain medicine and don't have the marijuana, it feels horrible. I don't want to eat, I don't want to drink. It is miserable. But I at least don't throw up as much. It's at least less. It's not something I want to go through. But not a lot of choice right now. I don't fear getting off any substance. These aren't the fear of being off the substance. I guess I more or less fear the potential of what it can be. I fear how long it's going to take. How many doctor visits is it going to be? How much weight am I going to lose? How much symptoms am I going to suffer before I either get taken seriously, find someone else, or it miraculously get healed, or just something? I've gotten clean from pain medicine before. I've gotten clean from substances before. But it's a shame. It's a shame that anyone has to make that kind of decision. I sacrifice this part for another. I am essentially choosing how I'm going to barely function. Am I going to barely function in this way, or am I going to barely function in that way? And the point of this video is to bring some light into the point of view from the patient. Now understand, I have medical family members that are in the medical field. A few nurses and everything. I understand the other end of the argument. I fully understand the opioid crisis and everything that's going on. I don't want to get into it from the other side. I fully understand the government is basically making you do what it wants. A lot of doctors don't have a choice. But sometimes you have to wonder how long. How many people? Did you know 60% of this country are chronic pain patients? Did you know 60% of this country are suffering pain on a daily basis? 60% of people in this country are either prescribed medication or hurting not prescribed and is trying to self-medicate. That's over half the population that's in pain. I feel like it needs to be hard to get on the medicine. First off, yes, it needs to be hard to get on the medicine. You need to have tried every other avenue, any other method, anything else possible, surgery, whatever. But if you've done everything, and this is what you're left with, I feel like it should be left alone. Many people are elderly, dying, essentially, and they don't get to be treated. That's wrong. To not treat everyone based on a few that are abusing it is wrong. I have it's wrong, ultimately. But I'm 28. I'm a woman. So I'm young. I'm a woman. I have some medical knowledge. 3 big red flags to doctors. I really hope you're having a good day, though. Whoever's watching this.